friends. I am Dr. Monik Mehta, Head of Department of Cardiology at Manipal Hospital Gurugram. It's my proud privilege to announce to you all that we at Manipal Hospital Department of Cardiac Sciences, we have done the first ever case of transcatheter aortic valve replacement in our hospital. This is a groundbreaking procedure which provides an important alternative for patients with severe aortic stenosis. It is a minimally invasive treatment option. It provides quicker recovery times and enhanced quality of life. This procedure was done as a combined effort of our cardiac sciences department, which was ably supported by our chief cardiac surgeon, Dr. Manmohan Chauhan, our chief cardiac anesthetist, Dr. Jitu Mani, and our non-invasive cardiologist, Dr. Parvesh. Our patient, Mrs. Anita Anand, who is sitting on my left, she is about 74 years of age and was symptomatic with severe aortic stenosis for quite some time. Because of her frail stature and the treatment option of a minimally invasive procedure, she was given the option of transcatheter aortic valve replacement procedure, which we call as a short form as TAVR. This procedure was done 2 days ago in our center, and she has done an excellent recovery. The result was excellent, and today, that is day 2, she's on her way and all set to go home. I would now request Mrs. Anita, who's sitting on my left, to say a few words about her experience in the hospital and how she's feeling on her journey about to go to home.
नमस्कार जी, मैं मिसेस अनीता आनंद बोल रही हूँ। मैं 2 दिन पहले हॉस्पिटल में एडमिट हुई थी। मेरा हार्ट की बुरी हालत थी। मैं चल नहीं सकती थी, बात नहीं कर सकती थी एंड सांस नहीं ले सकती थी। सो आई जस्ट केम फॉर ट्रीटेड माई सेल्फ। डॉक्टर मोनिक के पास आई हूँ हार्ट ऑपरेशन के, हार्ट की प्रॉब्लम के लिए, एंड इन्होंने बहुत अच्छी तरह से किया है। अनबिलीवेबल, विच इज़ अनबिलीवेबल। इतना आज इतना अच्छा, मतलब मैं बहुत बात कर सकती हूँ, मैं बोल सकती हूँ, मैं चल सकती हूँ। तो और अभी मुझे डिस्चार्ज कर रहे हैं एंड आई एम गोइंग होम एंड लॉट्स ऑफ ब्लेसिंग टू डॉक्टर मोनिक। थैंक यू।
Most welcome. Thank you. Now I will also request Mrs. Anita's son, Mr. Arun, to say a few words.
I'm Arun. She's my mom, Mrs. Anita Anand. Her age is 74. And I did not say anything about the medical condition and the procedure that was done. It was quite well explained by Dr. Monik Mehta. My biggest challenge was, and the biggest question for me was, that my mother gets a panic attack when the moment she sees a needle. So this procedure had to be non-invasive, and the injection parts and all those things would have sent her into a panic attack. I really have not understood even today how Dr. Mehta, Dr. Chauhan, Dr. Jitamani would have handled the situation. They handled it so well that my mother did not have any panic attack. She could hardly walk a few steps, and now she can climb a few steps actually. As far as the Manipal Hospital experience is concerned, I have been to quite a few hospitals, the so-called branded ones. There are queues and queues and queues everywhere, but here in Manipal I experienced that everything is quite organized. People are professional, the staff is there to really look after you. Things are made quite easy over here, whether it is your admissions point or your reception or any tests or anything you have to go. Plus, your treating doctor is always available to you. You have access to him, and he has access to you. So that's a very, very big advantage of being in Manipal Hospital, I guess. I'm taking back my mom today. She was fit enough to go back yesterday itself. In the last, I would just thank Dr. Monik Mehta, Dr. Chauhan, Dr. Jitu Mani especially for handling it. I could see the intense discussions half an hour before my mom was to be operated between Dr. Jitu Mani and Dr. Monik and Dr. Chauhan. How much of sedation has to be given, how calculative they were, because she's at an age of 74. Just a conclusion, some people are God gifted and some people are a gift of God. I think your team is one. Thanks.
and I wish you a speedy recovery, and we will like to see you on your feet in our OPD.
Thank you so
In
much.
case. Thank you.